What's up, Royals? I'm yours truly, King Chris. Welcome back to The Conversation. Police wants answers after a local hospital discharged a sick man and left him alone on the sidewalk.
Here, all new at 6. Police wanting answers after they say a local hospital escort a very sick man out of a hospital. Someone called 911 after finding the man collapsed just steps from the front doors. He still had medical tubes coming out of his body and ended up in the ER. Channel 2 investigative reporter Mark Winnie now live outside Piedmont Rockdale Hospital. Mark, you talked to an officer who helped rescue the man. Yeah, we went to an address where the patient had apparently lived. We tried him by cell phone. We got a statement in behalf of the hospital, but we also have reviewed police documents, interviewed a Conyers police deputy chief, and reviewed a 911 call. And those things say a lot. Conyers 911, where's your emergency?
Hi, sir. I am leaving out this medical complex, and there is a gentleman. Looks like he just came from the hospital, but he is passed out on the ground.
Common sense dictates that you do not treat human beings the way that we're seeing in this particular case.
He's not responding. I don't know if he's okay or what.
The call came to Conyers 911
It's at the Piedmont Rockdale Hospital.
from a concerned citizen.
But probably needs an ambulance. But he's right in front of the Piedmont Rockdale emergency entrance.
Says Conyers Police Deputy Chief Scott Freeman, who says he's concerned too about the circumstances of a 68-year-old man's discharge from Piedmont Rockdale Hospital Thursday based on what he and other emergency responders saw firsthand or later learned. He was clearly incoherent. Freeman says one of his officers documented that a hospital employee said the 68-year-old man had been staying at the hospital 35 days, that Medicare would no longer continue to pay for his treatment at the hospital, and that security dressed him and walked him out. He says an officer was told the man was, as the report says, cleared as fit to leave by two physicians, and the hospital wanted him gone. I don't have a good feeling about it. I think it's inhumane. A statement says, at Piedmont, our purpose is to make a positive difference in every life we touch. We can only provide the best care with the cooperation and consent of the patient. It adds, we do our best to connect patients in need with community partners and social service organizations to provide appropriate after-hospital care, but ultimately accepting these services is at the discretion of the patient. Literally ejected out to the sidewalk with no help whatsoever. That's just not how we treat people here in this city or in this county. Freeman says National EMS and Rockdale Fire responded, and a paramedic told him the man had a fever, signs of sepsis, which Freeman says is a dangerous internal infection, a urinary tract infection, an elevated heart rate. He says he was loaded on an ambulance to go to the ER. He needed to be in the emergency department. Now, Piedmont Healthcare says, unfortunately, hospitals often find themselves caring for people who cannot get into the kind of facilities that bridge the gap between hospital and home. Freeman says that a hospital employee indicated when asked where he wanted to go on hospital property other than inside, the man said Milstead Road and Milstead Avenue, and that's where Conyers Police found him. We sought a response from Medicare. An email said, we are working this for you.
So, Royal. So the man was sepsis, and he had a urine tract infection, which most likely led to him being sepsis. He was cleared by two doctors, and then he was discharged with a catheter, hanging. Make it make sense. Make it make sense. Make it make sense. Everybody that was involved in letting this man leave out of that hospital that way deserve their license taken, suspended, and investigated. It's nowhere that this man was that sick, and I'm pretty sure he was dehydrated as well, that was that sick, two doctors cleared him. And then a nurse just let him walk out of the hospital without doing her part. So my question to you, is it systemic racism in healthcare as it is in the justice world. Because this was really careless, and I really think he was only treated this way because he was black and he was poor. They said that Medicaid would not pay for him to stay there anymore, but he needed to go. This is the worst hospital ever. Ever. There's nothing you can say that could justify why they let this sick man out of the hospital. I would be afraid for them to even take me back there because I'm pretty sure they're still not going to give him the good care. They'll give him whatever they can to get themselves out of this ditch that they didn't dig themselves in. And I'm pretty sure the two doctors that cleared him and the nurses that let him go, I'm pretty sure they probably still most likely they got their jobs. I'm pretty sure. And it don't seem like they did anything to help this man. They asked him where he wanted to go. And so this is where he said he wanted to go. So this is basically where they dropped him off. They got security and put on his clothes. They did not do anything to help this man. They didn't even take proper care of him. So I know they didn't do anything to help him. Talking about the resources. They didn't give a damn about this man. I hope that this man gets the proper health care that he needs, that he recovers, that he's healthy. And I hope that he comes back and he sues the doctors personally, their license, because their license are insured. So he needs to sue them personally. He needs to sue the nurses and sue the hospital for his treatment. This is horrible. My black and brown skin people, meet me below in the comments and let me know what you think. I love you guys and everyone else. Please remember, stay up, never down. Until we meet again, may God bless.